Today you're coming back with you for, I'm gonna talk about a shoulder issue. Oftentimes with people, especially with cross-body motions or when they're pulling behind to reach their coat on, they're having some pain with that and limited ability to lift up overhead. With these kind of issues, it's more than likely a tendonitis going on in the rotator cuff, or they've got a partial tear, which is common, but it's become a issue in the fact that they're not able to do their normal activities. So another good one, have them start off with, is most people have poor posture, which is leaving them into that more of that internal rotation and forward position of their shoulder, and we need them to be up and out so that they have the better motion for that ball to move around in that socket. So again, the foam roller is a good one for this, working on a really good pec stretch. So have them lay lengthwise down, and then they're just gonna bring their arms out to the side until they feel a good stretch through the front of their chest. This promotes the shoulders being back, the upper back flattening out. It's just a very simple stretch. The longer they hold it, the better. Typically anywhere from 3 to 5 minutes of a static stretch is the best one for this. If they have some tenderness in the front of their shoulder and they don't have anybody to rub it, you can work on this a little bit, have them take the foam roller, roll it back and forth across that just a little bit, about every other day for about a minute. A doorway stretch is another good one, having them step into it, not lean into it, so that it's just a static stretch to help bring them back. The next really good one to do is for strengthening, is to work on those posterior posterior shoulder blade muscles to help promote that upright posture. So having them take a band, keep their elbows tucked in at their side, shoulders down and back, and going out to the side. 2 sets of 15 to 20 with this is a really good one. And the big thing is you want to make sure that they don't have the band too tight. It's just enough that they're feeling some resistance and they're working that way. Also, doing rows is another really good one to help with that. Not just doing rows down at your side, but also doing them up to your elbow, and then with the elbows straight. And we're just working the different trap muscles, the upper, mid, and low, to then promote backwards, as well as the rhomboid muscles. If they're still feeling limited in their motion, you can have them lay on their side with their arms out in front of them, and then have them rotate backwards to help increase that upper back tightness that they might be having from that poor posture. And then working on the pure rotator cuff muscles, starting off with low weights. Anything under about 5, you're gonna have them do the forward, shoulders down and back, forward, out in front at a 45-degree angle, and then out to the side with their thumb up. When they're doing it with their thumb down, they're just hitting that supraspinatus muscle right into the arch, the AC arch up here. So having them bring that with their thumb up helps promote more range of motion, and they're not getting the impingement there. After about 1 to 2 weeks of this, and it's still a nagging pain, it's getting worse, have them come and see us for a discovery visit. We can take a look at it, really see what's going on with the whole anatomy process, making sure that it's not just a little bit of a tendonitis, and then this will also help get them back to the gym faster.